Welcome to today's webinar. Thank you for joining us. I'm going to give a little bit of housekeeping first. This is just to say that if you have questions for the presenters, we will have some time at the end. You can place those in the Q&A chat box. Please use the Q&A box instead of the main chat box for that. If you have any issues with sound or other technical issues, you can message our logistical team on the main chat. Thank you for joining again. My name is Amanda Pomeroy-Stevens, and I am the project director for the USAID-funded Building Healthy Cities project. And I'm going to start us off with a very quick intro just to give us some common terms and to explain why we're here today. So to start, since we have a mixed audience, urban health may seem like a straightforward term, but actually the definitions vary widely. And we've learned this on the Building Healthy Cities project. So today we're going to go with the general consensus that social determinants of health, which means those conditions where people live, learn, work, and play, have a larger and or more interactive role on health outcomes in urban areas. And from our work, we found at least 8 different sectors where there are social determinants of health that have direct impact on health outcomes. These also interact with the different levels of governance. And in urban areas, these lines of responsibility and funding overlap more and interact more from the national to the state to the municipal level, and in those cases where there's districts as well as the district level. One final component that makes urban health different than public health or rural health is that, and when you have a larger, more concentrated population, you often have more interactive and lively grassroots activities working towards better health. Another term you're going to hear quite a bit today is smart cities. And again, definitions are not hard and fast on this, but globally, they tend to aim at improving information communication technology and the built environment. We'll mostly be speaking about the Indian Smart Cities program today, and you'll hear more about that from our esteemed speaker, Mr. Kumar. I just put up their goal statement here to show an example of how livability often plays a role in smart cities as well. So why are we talking about marrying urban health and smart city initiatives? From our work on the Building Healthy Cities project, we've been finding that there's sort of 3 core values that need to interact to really move the needle on urban health outcomes. These are multi-sector engagement, citizen empowerment, and data-driven learning or data-driven decision-making. As you can see to the right here, as an example from the Smart Cities mission in India, there's quite a bit of overlap or parallel in some of the goals that they have. And specifically, research we've done on multi-sector collaboration has shown that it's very hard for one sector to lead other sectors. What you often need is a group that's slightly above, but with similar relationships to all sectors to be an objective convener. And in this way, smart cities can play that role. Also, particularly with the Indian version of smart cities, they have put community at the core of their initiative. And this allows for citizen empowerment and citizen feedback to play a larger role in urban planning. Finally, as I mentioned in the definition of smart cities, ICT is a large component of the initiative. Now, just building ICT doesn't make you use the data, but in many cases, smart cities are also working to improve data use and data visibility, as well as data integration. So this is why we're thinking about this relationship and talking about it today. I'm going to finish with a few discussion points that we've asked our panelists to cover today. Because as we think about this relationship, there are some unanswered questions. First and foremost, how do we increase private sector partnerships, which are a part of smart city activities, but we don't always see them related to the health activities or health-related activities. Also, while I have mentioned the community plays a large role in smart cities, there's always a struggle to include the bottom 20% of the income scale. And so how can we do that better? Next is thinking about monitoring frameworks. So as you know, staff work toward their targets and their goals. And so how can we better integrate urban health and smart city frameworks? Finally, we want to understand how systems thinking and systems approaches can be integrated more fully into urban planning and design. So with that, I'm going to introduce our first speaker to get into these weighty issues. Anjali Kaur is the Deputy Assistant Administrator of the Bureau for Asia at USAID. She is an international development professional with comprehensive experience in the field with evidence-based integrated global health programs. Before joining USAID, Ms. Kaur was the Senior Program Officer at the Bill and Melinda Gates Foundation, leading global policy and advocacy strategies for the HIV and TB programs. Prior to that, she was the Senior Director of Asia Pacific for Malaria No More, where she established the India office and expanded the organization's work across the region, engaging governments, private sector, civil society, and media. Ms. Kaur was also with UNICEF's polio program, where she worked at the country and headquarters levels, as well as with the World Bank and UNFPA.
Thank you so much. Good morning, everyone. I'm delighted to be here in person to join the team at JSI, Dr. Nanda, and Mr. Kumar for this panel discussion on smart cities. At USAID, we always look at our India mission for innovation and to lead the way across our region, as it reflects how India, the country so often leads the way in adopting and adapting development approaches. It was no different in the urban health sector. The Asia Bureau, where I'm the Deputy Assistant Administrator, identified urbanization and its impact on health outcomes as a critical development trend. When we began designing Building Healthy Cities India, and specifically Indore, was the first to put up their hands to be part of this project. Under the India Smart Cities work, the main objective of the mission is to promote cities that provide core infrastructure, clean and sustainable environment, and give a decent quality of life to their citizens through the application of smart solutions. A number of these ideas which Nanda has already covered. We can note that cities lodge approximately 31% of India's present population and contribute approximately 63% of GDP. Urban areas are anticipated to house 40% of India's people and contribute around 75% of India's GDP by the end of 2030. Therefore, smart cities are an opportunity to improve lives in India. I have lived, worked, and visited many of the smart cities themselves across India and have been interested in how the growing urban influx across countries, as well as in India and across other countries in the region, can keep pace with the needs of the population and address the key issues at hand, such as electricity, waste management, sustainability, water pollution, air pollution, public transport, and other issues like crime. So these problems need smarter solutions, and that's why this program is so critical. The majority of its projects have targeted the most marginalized, with those that are completed demonstrating strong social and economic benefits, which naturally leads me to recognize the long-term timeline required to truly make the change that's needed to address the urban poverty that's become so rampant across the world. And so I think about how much these innovations could impact other countries where I've worked and lived, such as Brazil and urban favelas and spots, and where India can truly lead by example. I think about when I used to work in favelas and community development, and we speak about smart cities being led in India by the core of the community, how much cities in Brazil needed that. They were already developing through the community, but they didn't have the solutions that were provided by the government to be able to lead by example. So Mr. Kumar will speak to all of this in much greater detail. While Building Healthy Cities is nearing the end of its project date, the continued investment by USAID in urban futures is continuing. USAID's continued investment will take shape through the Gandhi King Development Foundation, which will build upon Building Healthy Cities and look to sustainably catalyze private sector investments for sustainable and clean solutions for smarter cities. USAID looks forward to working with the government of India and established in the Gandhi King Development Foundation to leverage the Indian private sector to address these development priorities across the country. In addition to this foundation, USAID continues to support for and the leadership with the Coalition for Disaster Resilient Infrastructure, an India-led global climate initiative whose objective is to invest in the the resilience of new and existing infrastructure systems to mitigate climate and disaster risks, thereby ensuring sustainable development. We know that in Asia, the future will be urban. We also know that with sprawling megacities and unchecked climate change, we need to look for smarter solutions that will help people in cities thrive and contribute to economic growth. We need to harness the digital revolution, again, a sector where India excels, so that cities can manage their resources for optimal allocated efficiency. Vulnerable populations face special challenges as the COVID-19 pandemic highlighted all too clearly. How can we practice social distancing when we live on the street and have no home? USAID is committed to urban work in Asia, and we're equally committed to supporting both. Our conversation today will highlight some of the innovations being put into place that support these objectives. I look forward to these discussions today, and I thank you for including us in this.
Thank you so much. That was a great point. Our next speaker is also from USAID, Cynthia Geary. Ms. Geary has spent most of her career working on foreign policy and international development issues, and has extensive experience working in the Indo-Pacific region. She currently serves as senior advisor in the Health Office at USAID in New Delhi, India. Previously, Cynthia headed the State Department's East Asia and Pacific Media Hub based in Kuala Lumpur. She also served as the Chief of Staff to the Ambassador of the U.S. Embassy in Australia. And she worked for FHI 360 as a consultant on HIV/AIDS programming in Beijing. In Washington, Ms. Geary serves as the Director for Planning at the National Security Council, Deputy Chief of Staff to the Administrator at USAID, the Chief of Sports Diplomacy Programming at the U.S. Department of State's Bureau for Educational and Cultural Affairs, and also as a Program Officer. Cynthia graduated from the University of California, Davis, with a bachelor's degree in international relations, and also has a master's degree from George Washington University.
Thank you, Amanda, and thank you to the Building Healthy Cities program and USAID for hosting us today, along with Brandeis University and Dr. It's great to be here with Deputy Administrator Carr and also Mr. Kunal Kumar, who has the slides of this picture. Next slide. So to build on what the Deputy Administrator just said, the McKinsey Global Institute estimates by the year 2030, there will be 68 Indian cities with more than 1 million people. There'll be 13 cities with more than 4 million people and 6 megacities with populations of 10 million people. So India is urbanizing at an accelerated pace, with nearly 400 million people now living in urban areas, and much more if you consider an expanded definition of what constitutes an urban geography. Recent estimates suggest that the total urban population in India is over 34%, but other sources show that up to 60% is urbanized, and that figure is increasing every hour. So these blurred boundaries of urban expansion challenge planning and delivery of services. And the COVID-19 pandemic has highlighted the need for strengthening urban governance and accountability. The growing burden of non-communicable diseases, the continuing burden of communicable diseases, and the fact that urban India is often at the epicenter of environmental and man-made disasters like air pollution, floods, pandemics, climate change, really demand an integrated approach to urban health to achieve urban development and resilience in the shores. Next slide. So on basic health care, the urban poor often have it worse than rural India, both in terms of access to services and health outcomes. India's historic focus on rural health delivery has meant that the needs of the urban poor were often overlooked. And if you look at the first graph on health service delivery, 75.2% of poor urban women have access to assisted births in comparison to 78% of women in rural India. And this trend sustains with respect to access to postnatal care, where only 52% of poor urban mothers, as compared to 71% of rural mothers, seem to receive the same care. Challenges such as reaching migrant populations and the lack of social cohesiveness in the urban setting reflect in vaccination rates. 40% of urban poor children are not fully vaccinated. The urban citizen spends more on healthcare than their rural counterpart in India, and often the cost of medicines account for nearly 75% of the expense. Next slide, please. So USAID in India has been a forerunner in the arena of urban health. Since 2001, USAID has engaged in active partnership with the Ministry of Health and Family Welfare, beginning with our environmental health project in India, which in 2005 transitioned to an NGO, the Urban Health Research Center. In addition to providing long-term assistance for improving water and sanitation in urban areas, our advocacy for and research on urban health eventually resulted in support for the National Urban Health Mission. And in response, our USAID Health of the Urban Poor project, or HUP project, was designed to work at state, municipal, and community levels to develop innovative policies and program strategies to better meet the health needs of the urban poor. So USAID India's efforts have been to build knowledge on the extent and nature of health challenges among the urban poor and use this information to advocate, design, develop models and strategies and institutionalize delivery mechanisms for urban health. It is our ongoing effort to help support the urban health systems to make them resilient, a necessity underlined by the pandemic. Next slide. So here are some of the projects that we're working on currently. And as you can see, we're working with a wide variety of government partners, both at the national level, the city level, and various ministries across the government. Next slide. So we have several major learnings in our urban health journey, and several are listed here. Some of the continuing challenges for urban health that we see are limited urban local body participation in urban health, access to primary health care, comprehensive primary health care, specific strategies and models for migrant populations, and an urgent need for convergence with other sectors to promote nutrition, availability of water and sanitation, prevention of domestic violence, and the need to address environmental hazards and disaster management. Next slide, please. So when Amanda was talking about convergence or working with the Smart Cities agenda, USAID India is already working with several of these sort of fundamental principles. Our community strategies and models developed and tested have been scaled up by the National Urban Health Mission and the National TB Program. And these are mapping vulnerable populations and vulnerabilities to better target interventions, empowering community groups such as the Media, Arogas, and EPs to ensure communities are taking charge of their health, and also our TB and youth champions to ensure ground level change agents to eliminate TB among the urban poor. And the design of strategic outreach sessions under the NUHM embodies the more for less principle, ensuring that services reach the most underserved communities. Strategies such as primary healthcare networks and public-private partnerships using strategic purchasing and more recently the sewage surveillance system for COVID contribute to the integration, innovation, and sustainability principle of the Smart Cities agenda. And by leveraging technology for urban health, our models of e-enabled health facilities, medicine vending machines, quality assurance programs are all being scaled up by the government of India. And more recently, we have leveraged technology to provide predictive analytics during the pandemic. Finally, several urban convergence models have been designed and tested by USAID, and many have been scaled up. However, this is an area that requires further investment. Next slide, please. So our new emphasis for urban health in USAID India is building resilience, and we build on USAID's key strategic priorities. And at the core of our urban resilience model is the goal that every urban citizen thrive by ensuring comprehensive primary health care, addressing social determinants of health, strengthening urban governance, and employing data, technology, and key stakeholders efficiently and effectively. I'd like to thank, next slide, you for the opportunity to share our urban health journey. We're committed to building resilient urban health systems and look forward to strengthening our partnership with Smart City Mission to achieve exponential outcomes for urban health. Thank you.
Thank you so much. That was a great synthesis of some of the key challenges in urban health and why this is such an important issue. We are so pleased to have our next speaker here, Mr. Kunal Kumar. Mr. Kumar is part of the Indian Administration Services. He presently holds the position of Joint Secretary and Mission Director of the Smart Cities Mission within the Ministry of Housing and Urban Affairs in the Government of India. Held that position since May 2018. Earlier, he was Municipal Commissioner at Pune Municipal Corporation in Maharashtra. He's been working with the state of Maharashtra since 1999 and has served across various cities in that state. Mr. Kumar has worked as district collector in 3 districts, Bandara, Jalgaon, and Aurangabad. Forgive my pronunciation. And has also worked as municipal commissioner at Kolhapur Municipal Corporation. Mr. Kumar has an electrical engineering degree from IIT Roorkee and has successfully completed his master's in public management from the National University of Singapore, jointly conducted with Harvard Kennedy School. Mr. Kumar was also awarded by the Prime Minister of India for excellence in Aadhar Governance Awards during his stint as the district collector at Aurangabad.
Thank you, Amanda, for the kind introduction. Begin with the GSI and from the person discussion and all the exciting and amazing people. Good morning from here. And, I'll focus on using some of the elements of the Smart Cities mission that we are implementing here, and I'd like to see how best we can further the initiatives held in the sector, the most important elements that emerged, especially in so may I go to the next slide, please? This is a mission which was launched in 2015. Recently now, the country, which is a smart city under the mission, has a special purpose vehicle, separate company which is established to implement the mission. Close to $30 billion investment in 5 years, 5 to 7 years, and of which 6.7 comes from the government of India, 6.7 comes from states, and the rest comes from the country, and so on. And the government funds are largely supposed to be catalysts to attract funding from and this is part of an overall strategy at the national level, where multiple programs are being run across the country. Some of the programs, like basic program for poverty alleviation, affordable housing, sanitation, across all the 4,000 cities. There are programs on fixing water supply, sewage, and septic infrastructure in 500 cities. And at the top of the pyramid, you see there are 100 cities which are largely as laboratories or lighthouses, as you may call them, for testing out new innovative ideas in the field of urban development. These are where the smart city mission. Next, please. And if you see the kind of strategy we have under the mission, every city is basically looking at 2 kinds of. One, area-based interventions, where they pick up areas, either redevelop them, completely retrofit them, or do greenfield. And each of these cities have a different model here. And planned city development, where you basically deploy solutions using technology, may or may not use technology, but largely they have been using. affect sectors across the entire city. So be it health, be it transport, once again, different cities and so that's where we are, 6,000 projects being implemented currently with about $27 billion. Next slide, please. And if you see where this money is going into, largely, if you see social economic development is about $6 billion, mobility is about $6 billion. And the rest, as we can see, for paucity of time, but they will be available. So next, please. And of the wish list of close to about 6,000 projects, we have close to 5,700 projects worth about $21 billion USD are on ground now. We've completed about $7 billion of projects. And it's been a steep learning curve. And these projects span multiple different sectors. They are projects of public-private partnerships, and integrated technology into cities, smart streets, smart solar and renewables, water and wastewater sanitation projects, urban spaces, and so on. Go next, please. And so, what I like about this, this definition by WHO is that a healthy city is not basically a static outcome that you look forward to. It's basically more like a dynamic equilibrium, which keeps changing over time. And you really need to be agile as a city to be able to work on its physical and social environment to respond to the needs as they arise. So it's more a process than an outcome. Of course, outcomes are important, but the process becomes important. Go next, please. And the systems approach, in fact, not only in health but across, and this is something that is intuitively seems simple, but it's very difficult on the ground to achieve multiple reasons. You have short time spans, you have the desire to produce quick results, you have siloed functioning in government for good reasons, because that's supposed to be an efficient way of functioning, which is where systems become very difficult to really implement at the integrated level, which is a challenge that we face. Next. This is something that I've taken from USAID, the graphic. When you move from being isolated, you move from looking at things in a very superficial manner, or in a manner where you look at short-term goals to looking at quality of life in the market and reduce health costs. Go next. So few glimpses that I'll run through them quickly. Active living, our smart cities. In fact, so please go to the next slide. Keep going quickly. I just wait. So we have two national challenges part of the mission. One is the Cycles for Change, by promoting cycling across the country, and there's Streets for People, where active living, walking, and walkable cities, and building streets that the rest of the country are being developed. So next, please. The healthy streets policy is now being adopted. We move from what we call the complete streets policy to now the healthy streets policy, integrating a lot of other aspects of environment, health planning, economic planners, streets basically. And these are the 10 pillars of healthy streets which are emerging. Once again, when I talk of these pillars, they're not really pillars we decided upon and we started implementing. These are what emerging from our practice and ground. So these are very empirical sort of nature. Go next. And now, once we start looking at, so the idea is that we look at practical initiatives. We get the cities to buy in, we get the stakeholders to get buy in, build bigger coalitions, and then we focus on world scale. Now, we do all these challenges. And there's another nationwide campaign where you're promoting the public transport. In fact, people back into public transport, keeping in mind social stakes. COVID, and a lot of startups are joining hands with us. And then, of course, another campaign to promote nurturing, reclaiming the spaces which have been lost, and usually grounds in some places which are corners. So the community would like to do a lot of meaningful activity which have not been used so far. So those kinds of places are getting reclaimed in the cities. You can see one of those examples in the picture. And we have another campaign on smart nutrition, and which we call the Key Smart Cities Challenge. And so you see there's a pattern to this where we partner with multiple organizations who are experts in their fields, and then bring the strength, the competing power that we have as a mission, and the strength that the partner organization has as an expert in this particular area, and we implement these challenges across the cities, build practice and deepen expertise in the cities in such crucial areas. Go next. And we are looking at accessible healthcare. These are mostly project-based interventions we're talking about. Go next. We're looking at telemedicine, smart health centers. We use technology to basically increase the reach for health. Smart clinics, which are basically established in low-income communities. Smart health cards. We had recently launched the National Digital Health Mission, where the Prime Minister actually launched it very recently, where each citizen of the country is going to have a health ID, sort of, which will integrate the kind of model that Cynthia was talking about, aggregator model. This would be the beginning of the aggregator model in the health sector. Some of those initiatives starting to happen. And accessible healthcare, again in low income communities. Go next. Go next, please. So these again are interventions that are picked up are happening in low income communities, essentially the inclusion aspect. So toilets, water, toilets. A lot of infrastructure is being built across the waste management. This is one area where we really have been able to do a lot of change in the last 5 years. From a situation where we went close to 20% of our waste process, the rest of the landfills. Today we have close to 70% of the waste from 20 to 17 to 5 to 6 years. And I presume that by in the next 3 to 4 years we'll be able to go close to 20%. So this is one area that we need to next. And of course, cities are promoting renewables, fuel burns. See, floating solar plants. In fact, some of our cities are building the largest floating solar plants in the country as part of the mission. And a lot of emphasis on not only solar but renewables like wind, also fuels, electric mobility is happening across the country. And of course, to bring it all together, we are deploying a lot of technology to integrated governments. Ours is the country, which is federal country, so we have city level government, state level government, all functions at the city level, different organizations look into it. And it's not a kind of a central system where you have a responsible mayor who looks into a lot of functions in the city with multiple different organizations. So in a way, technology is becoming the aggregator or the integrator of sorts, and is bringing together a diverse set of organizations to work with. So we see a lot of investment happening. And if you see here, it was this investment in technology which really helped us in COVID through this 4-quadrant approach, if I may call it. A lot of technology got used to build communication, two-way communication with stakeholders, managing the pandemic, which was including infrastructure, logistics, a lot of different stuff, and then information gathering. A lot of the management of the pandemic required a lot of information from resources, ID to a lot of use for that. And of course, preparedness, predictive modeling, stuff like that. So this is how we deploy technology, some of our investments in technology. We could repurpose a lot of that investment into management. Bonus. Gives us some glimpses of how technology got used during the and as you see, so we're now talking about outcomes. So it's a very delicate area. How do you really create indicators to really measure how cities are? Everybody has a different goal. Everybody has a different aspiration. So in a way, a common set of frameworks where you can start to benchmark cities, create a sort of healthy competition, learning from each other, knowing your own comparative cities and trying to understand from each other what best practices are there in the city. So there are multiple of these indices. In fact, if you look at the entire set of indicators, we're really looking at monitoring, you can call it, or at least nudging cities to look at. They're about a set of about 700 indicators. And 700 indicators seems to be a lot of indicators, but they look at by different teams on aggregate 700 indicators. So what we call the ease of living index actually measures how livability is improving. If you see the climate smart cities framework, it's one of its kind national framework where we have all the cities benchmarking themselves. We've done two rounds of this, and we now start the third round in October. The Scottish Survection is a unique initiative which basically runs the green cities in the country for the last 5 years. It's become a real competition. People have dedicated a lot of time and effort to improve their rankings here, which is why we see a lot of the city GDP framework. We've always talked about cities producing the GDP at, in fact, India was mentioning 31% population, 63% GDP, but we've never really gone down to measuring city GDP percentages in our country. We do at the national level and the state level. So that's another area we venture in as part of the Smart Cities Mission. A lot of work on data is happening. Before the Smart Cities Mission began, some of these cities, very few of these cities had city data offices and the wherewithal to handle a lot of emerging technologies, AI and machine learning. Today, all the 100 smart cities are actually have deployed data officers, data teams, data champions, and they have a lot of different work which is happening. We've come quite a long way over the last 5 years in working on data, which also, as was pointed out, is also mentioned it in her presentation, is about how do we integrate data and technology into aspects of health, because that's, I think, the future of how we move on access, quality, and so, which is where work needs to happen on developing the right ways, KPIs, specific guidelines and standards, and how do we enable integration between different stakeholders who seem to be working as insiders, but can possibly work very well in this. Smart city monitoring frameworks will have to document these things to promote them now. Currently, some of them will be and of course, encouraging private participation, as we just talked about. We will take the discussion. I would say, in fact, go to the next slide. We'll just cover this slide first, and we'll go just give the last one. So, yeah, operationalizing innovative governance and business models is very important. I think we fail in herb and stuff of water and waste management because we don't make the mechanism, and therefore the public also. And also getting the academia into the business of actually looking at different complexities and working with us sort of lab to lab. But that seems to be missing. Of course, the role of civil society, in fact, to the extent of community funding to some extent, and also community-based monitoring of health outcomes is something that we are proposing. And a lot of public-private participation is happening, by the way, but it's not really held here. You see, it's happening on mobility, it's happening on ride sharing, affordable housing, lighting, waste management, solar. There are so many areas, but not really in health. So that's one area where business models are not, may not have developed that much. Right? So some of the areas that we can look at PPP, as I said, waste management, sanitation, water, technology, water, inclusive housing, environmental solutions. All these are areas which impinge health in some ways, but not directly in the sense that we talk about. But these are areas where we can improving our systems. Nobody can work around including your own internal systems to be able to manage. If you are not able to manage your own systems, you're not able to manage. So that's one area that we have to work on. Enhancing execution capacities in our cities has been a problem. It's a learning curve. That's something we are working on. So different initiatives. Not that we have to talk about. But yes, that's an important area that we're working on. Of course, enforcement of contracts, legal situations, And again, what we've seen through COVID is the use of technology. A lot of digital can be used for public-private partnerships as well. Telemedicine is one area. As I said, digital health records, aggregator models that we talked about. Health ATMs for some kind. And the use of artificial intelligence for decision making. These are areas that we need to venture into. And also kind of build public and some areas are marked public, some areas are marked private, and almost like a hub and spoke model, where some spokes can be handled privately, some spokes can be handled public. Different models are emerging which can be scaled up. We just see inklings and beginnings of those. You can really see a lot of that happening. Of course, delivering affordable diagnostics is another area. I think the three key words for me, health, as I imagine going in the future, for us to be focused is access, quality, and efficiency. How do we improve access to health? How do we improve quality of health services? How do we improve efficiency of health services to deliver to hospitals and public systems? These are three areas of technology public use. Go next, please. And therefore, thinking long-term, planning comprehensive, active integrated, building partnerships. And from the feedback mechanism, I think involving the community in different cases, it's not only about involving asking them what, but it's also about using the expertise that exists in communities to have community needs, to actually implement community infrastructure, to go create solutions in some ways, to be partnering with communities and monitoring of work that has been done. And this can be done both with digital as well as physical needs. So closing the feedback loop in some senses with the right stakeholders. And these are certain things which have started to happen in sectors again, especially in waste management. We've seen a lot of our Prime Minister also Jan Andolan, which means a public move, and we will have to. We have also taken a lot of other initiatives in the field of education and other sectors. Health needs to really I think this is the right trigger. If we can't do it now, post-COVID, I think the most important trigger we have to push our health systems and the right So this is something that we really have to work on. Apart from public-private partnerships, using and infusing technology into improving quality, access, and efficiency, and strengthening feedback. So that's it. I stop here. There was fascinating discussion. Then I'll respond to our discussions. It's been a pleasure.
That was a great survey. Lots of information, and I'm so glad that you touched on waste management, both as an area to learn from, but also because of the impact. Oh, I'm going to hand over hosting duties to my co-host from Brandeis, Dr. A.K. Kumar. Dr. Nandi Kumar is a professor of practice at Brandeis University, where he is the director for the Master of Science program in Global Health and Management, as well as the director of the Institute for Global Health and Development. Dr. Nanda served as the first chief economist of the Office of the Global AIDS Coordinator, and prior to that, served as the first chief economist for the Global Health Bureau at USAID. Dr. Nanda Kumar is an internationally recognized health financing expert, known specifically for his work on resource tracking, national health accounts, health financing, and healthcare policy research. He is also a former Indian Administrative Services Officer, and he also serves as the chair of the Program Advisory Group for USAID's flagship urban health project. Dr. Nanda Kumar has a Master of Science degree in mathematics from Bangalore University and a PhD in economics from Washington.
Thanks, Amanda. Thank you so much for this wonderful discussion. This has been fascinating, and I'm going to ask a few questions because so much rich information has been shared. Let me start first with Anjali and then Kunal, I'll move to you. So the question is that what is emerged is that urban health is really a function of various other things that are known. So from a USAID perspective, how do you embed the principle of health in all policies in sectors that are not actually used to thinking about health outcomes?
Thank you. That's a great question. And it's one of my favorite questions. I've got a health background, but because I cover so many other areas within our region of Asia, it's really important for me to integrate health into everything. And it's unfortunately taking COVID to demonstrate that to everyone else, to get everyone else to that. Because I think, as Cynthia and I are both saying, we're already confident it's never going to be here. But how do we get the rest of the world on this? It takes something else to do that. So in this specific situation, I would say we need to use a framework of promoting collective impact to embed health in all policies, right? So there are five parts to this framework that I wanted to outline that we support yourself. The first is to establish a common agenda. So that reflects the smart cities mandate. Everybody wants to live in a city that functions well, is efficient, and that promotes health. So you can introduce health as part of the common agenda. And Mr. Kumar had already highlighted this, and I want to emphasize how critical that is. So then you need to talk about how you have a shared measurement, right? And so we talk about evidence-based decision-making, how data is so critical. So for example, the city's beginning to switch to all electric buses and reducing the level of particulate matter. So you compare the data points of the number of electric buses in use with the number of clinic visits for the management of asthma. Or you could look at waste management and diarrheal disease, or market access and nutrition status. The point is that every measure in other sectors has a health impact. And we've all discussed this, but how much are we actually looking at those measurements to discuss the health impact and the change that some of these decisions have actually made on the population? So next, any master plan of action must have mutually reinforcing activities. And so BHC did this with their work on health messages for schools, pairing the health and education sector. You can do it with labor markets and health as well. So for example, working to ensure that women have access to microfinance because there's evidence that increased incomes for women impact on household level health. That's something we've all learned from the microfinance decade, I think, in the past, that you put women in decision making, you have broader health outcomes for the entire household and possibly other communities as well as women speak to other women and do some joint decision making. The fourth part of this framework is critical, and I think that Smart Cities program India has reflected this principle specifically. There needs to be continuous communication. So all the stakeholders involved, there's a wide pool in a smart city. So we need to be getting the same messages and information. So this builds trust and creates a common motivation. So all the smart city staff understand that no matter what sector they work in, they're contributing to the health of their city. They will be better agents of change in implementing the concept of health in all policies. And last, to do this work, there needs to be a background. And so this is already in place in Indore in the sense that Mr. Kumar is the Joint Secretary and Mission Director with the team. He has a staff with an administrative system and practice that can support the idea that the whole of government contributes to achieving positive health outcomes. This becomes a virtuous cycle. With the population becoming healthier, they have more social and labor capital to contribute to continued development of the city. And so if we want to look at urban spaces that create health along with wealth, then implementing this collective impact framework will ensure that no matter what the sector, all the stakeholders know they're contributing to it.
Thank you. What I took away from that was that it's a very clear framework, but also that we want to move from health to family well-being, right? And then integrated programming and the use of this demonstration of interconnectivity, where these are mutually reinforcing, right? With strong support at the back. And that actually leads me now to a question that I'm going to ask you that so we both come from the Indian Administrative Service, and he's an urban expert, but I just spent 3 years managing a municipal corporation in Maharashtra as well. So one of the questions I had for you was that the institutional arrangements, you touched on governance, I'm going to ask you a 3-point question. So I'm going to give you all the time you want to ask. So the institutional arrangements, right, because the smart city initiative is really forward-looking. It is inspiring. It is absolutely things that are being done holistically, but in a very systematic way. So what are some of the institutional issues that you've encountered as you start implementing it at the level of the city, and what are the steps you're taking? The second question was that if you look at urban settings, 90% of care is provided in the private sector and largely paid out of pocket. So the elements of markets are there. You have distance is not a factor. But the real question is, how is the smart city even thinking of bringing these elements together through incentives or through business models or through other arrangements where you can get the markets to start functioning for those who are really poor. And the third one was you really hit upon a very important point on the role of research and data and academia in informing the impacts. So what is your thinking about this? In terms of my question to Anjali, but kind of leads directly into your own lived experience.
Yeah, Dr. Nanda, I actually started to call myself an expert. Things are changing so dynamically that always nothing people, keep pace with the changes. I think on the institution that you're talking about, you're aware that city as a level of government is formally recognized by the 74th Constitution in the year 1990. And that's also it's not really mandatory for the states to do that. So different states have rolled in different. And then based on which state you're talking about, it's talking about Kerala, outcomes have panned out. In a way, what's probably needed is to create, sort of learning to pull up institutions. Seems easy, it's very difficult to do this. How do you create incentives for people to actually share best practices and incentives for people to learn? Work through a system where incentives are bureaucratic incentives are. How do you actually push the officers to learn, share, reimagine things by looking at what peers are doing in other parts? That's probably one. The second way, of course, as I said, the spirit of healthy competition, which comes through evidence-based benchmarking of things. If you have the right set of indicators, I understand that pitfalls with, when you make incentives too far, Goodhart's law, where once you measure the performance, push certain benefits on top of it, and then it starts to get paid. So stop at that. At least nudge cities to look at the indicators and compare themselves. That's another area. What we're looking at in the field of technology is the creation of what we call the data alliances. And we have alliances now in across the fields. What an alliance is about public and private partners. Let's say, for example, you would like to predict the next dengue or malaria epidemic in our slum. So data which resides in public health offices, education departments, sanitation departments, in local hospitals and government hospitals, all of those stakeholders coming together and forming a health data alliance to create a mechanism which is a loosely structured, formal, semi-formal structure coming together to actually solve the problem of a particular slum. Those are kinds of institutional mechanisms, the new age institutional mechanism with hierarchy, horizontal, no hierarchy. Anybody from the community can actually take up the onus of convening such a thing. Was initiated largely by the government, but then as progressively it takes on new challenges, new people take on the leadership. those kinds of things are emerging again. These are just beginnings. A lot of integration also is possible for technology. The technology at one single point of time gives you access to information that I have, that you have, that everybody else has. So bringing together a diverse set of people on the platform happens very, very well. Of course, integration that we talked about also on the level of not only bringing people who directly deal with health, but also directly or indirectly deal with issues like environment, mobility, education, which aspect of health also happens very well with technology. So those are areas of potential institutions. On your second issue on the private markets, you of course have the Ayushman Bharat scheme where health insurance up to a certain mandated amount is being provided cashless. Of course, cashless for the beneficiary, but not in case of premium, something similar you have in the US. It's been working very well, but it needs to be going further. What I think of from my own practice is, I think we need to work even more on building better public systems. I think we have to make public systems a minimal benchmark for the private sector to be involved. I think our public sector, if it goes to a certain level, where as a private sector entity, you will not be able to be in the market, you actually don't meet a certain level of benchmark, which is often not possible. Then I think holistically, both public and private, holistically the entire health infrastructure goes up. So the impetus on the public is to improve itself to a certain level that you become a benchmark to deal with. You can't be in a market where you can't even offer that basic level. And I think that's a hybrid model I'm talking about both public and private. I'm not sure if I'm answering the question on markets because I may have some observations on that, but I really not have the answers. And the third one, of course, we need to engage much more deeply with research institutions. There's a lot of knowledge and science in India. There's a lot of research institutions which are working on cutting edge information research areas. You've seen how during the pandemic, the response of the country was both on vaccines and the kind of health infrastructure that it could build. And a lot of this happened because of the good research that exists. There are many ways of doing it. I think again at the level of the city, kind of a three-part type, four-part collaboration where problems diagnosed with the communities are thrown open for research institutions to find out the right solutions. The solutions then get adopted by the industry and developed as technological products, and they then get cycled back into the city in the community for where there's a problem. So this kind of a loop can really get established in some. We tried in a couple of cities. We tried in Kanpur, for example. So Kanpur has a big problem of environmental pollution. So there is a Indian Institute of the country in Kanpur, which is called the Institute of Kanpur. They actually looked at the problem, and they've now come out with a very innovative set of environmental sensors, which are really 1/16th or 1/20th of the cost of sensors that are globally available in the market. Of course, the challenges with them, you have a certain lower level of accuracy, but that's okay. I mean, that's the trade-off. With that 5% deviation from accuracy, you actually get it at 1/20th of the cost deployed across the city. And then now they've actually 4 startups in the country have picked up those sensors and are deploying them, not only in Kanpur but other places. This is a very good example of how a problem got picked up by an education institution and then is now getting productized across the country. So these are some things that I'm seeing emerging.
So this is wonderful. So I picked up on a number of things that this is a question that I'm going to pose to all the panelists. So the question of using data analytics and data alliances came up, right, as a way of better integration, better planning, better monitoring. The question of learning platforms came up, and the question of innovation has been the theme that has gone right through this. Now, one of the things that was highlighted here, the 2 things that I picked up, one was that a lot of progress has been made on issues like waste management or new solar energy, etc. But health, more work needs to be done on health. So my question really was that if you kept the perspective of equity, because one of the things that emerged was that inequities still remain in urban settings, and they get more exacerbated as urbanization picks up. From a USAID perspective, and also from the government of India's perspective, how can you use all of these things that we've been talking about to address the question? Some thoughts on that. Who would like to?
I also want to invite.
Cynthia, you want to speak to it?
I think for us, what we realized, and I go back to COVID, is that the highlight of inequity has come up stronger than it would. I think what it's demonstrated to us, I always say this, is that any weak health system would crack. And so what we recognized in this space was that if there's weakened health system, the level of attention that's paid to them is only understood after a widespread incident, or as you're tracking treatments. And so I think the problem that we've had, to your question, is that we just haven't been able to connect the dots. I think that we forget that when a population is the most vulnerable or marginalized in every way, their access to everything is limited. And the data for us to be able to understand that is so limited that we only focus on the one or two things that we recognize or have been highlighted, that are visible to us. And so my earlier point was really, how do we connect the dots to each of these pieces that tells us that their circumstances will change as a result, not just their health circumstances, but their circumstances in terms of access to wider services, right? And being able to, and that's the data decision making, is that how do we use that data decision making to actually demonstrate where equity actually changes? It's not just where waste management changes, but what are the measurements of equity that we're actually trying to look at? And how do we compare that with those that are in the rural sector or those that are middle class in urban cities that we're using? And I think that is what we haven't been able to get to yet, is that there's a fringe that's in the cities that looking at, and they're not necessarily in urban slums, but they're in populations that have been marginalized in urban and rural areas. So when we're focusing on this, how do we demonstrate what their indicators of success look like? And you have 700 indicators, and I'm sure that's there across that, but how do we highlight that as an aspect of equity? Because honestly, we haven't looked at inequity in the way that we're all facing right now. We haven't looked at inequity like this in global health. We haven't looked at inequity in terms of the global population. We look at this in terms of vaccines, broader access to services. So I think it's the right time to actually demonstrate through data and through a standard indicators of data, what is the progress on inequity? And then what are all the different measurements that demonstrate that? It could be education, research, or whatnot, but what is that overarching sense?
And I could just give a specific example from the work we're doing indoor. I think it's a great point, and I want to pick up the resiliency thread that you mentioned as well. But so we are working on data integration within the ICCC and within our Indonesian city, but that does take a long time. You have to get the data agreements in place. There's just so many layers. So in the meantime, two examples. One is that, as I mentioned, the citizen reporting systems these smart cities developed are so helpful. And BHC is trying to help expand the indoor, the access to citizens in indoor to those who might not have smart cities. So looking at SMS options. And what the ICCC in indoor has done is linked those complaints to their dashboard. So it's the first step of their integration. So you can actually see where those complaints are coming up. And that will sometimes highlight that there's a certain section of the city or neighborhood that's really struggling with some of these issues. And so that's helping to redirect at least transit and waste management there. Now, again, to pick up on the waste management, it is so impressive what indoor has done and what many cities under the smart cities guys has done. And one thing that happened during COVID to help with equity issues is because the waste management trucks had full penetration in the entire city, 100% of the households, even in slums. They started putting food on the waste trucks, or having trucks follow behind with food rations behind the waste trucks so people could get food out to those who really need it, which I think was a great example of how to sort of leapfrog when we have some of these issues of these pandemics, to really piggyback on those systems that do have full penetration to be able to get out some of those issues.
Oh, just one more thing to follow up on that. In indoor and some of the other cities, we're working on with our urban health programs. We are working with different community volunteers who are out working with the most vulnerable We try to get them to sign up for different services that they're eligible for, but they may not know about. And so that's a better point where you could get data and information from the community to the
Yeah, so on this point of equity, I think a lot of us probably might try to change the lens from looking at income inequity to access inequity. I think that's the way we are fundamentally trying to change the orientation of the imagination in our city. So we look at, something called what we try to describe as affordable excellence. It seems like an oxymoron, something which is affordable can't be excellent, vice versa. But look at your mobile phone, it's there with the richest of the rich and the poorest of the poor. Everyone has a brilliant means of communication, which is cuts across all income segments. So that's access equity, access to a communication technology. So we have to think of health in terms of the mobile phone as to how do we bring health in that way accessible to everyone, irrespective of incomes that you may have. And so this will need a lot of business models, a lot of interesting ideas and innovative financing and cross-subsidizing. So for example, if you need to fix public transport, walkability, and cycling, you would have to go for transit-oriented development. You would have to have some kind of parking charges, congestion charges. These are harsh political decisions to take, and that money would then need to be cycled back into promoting sustainable transport. The same can happen in housing. You could, through the private development will happen in the city can develop, either develop for itself money to provision for affordable housing, social housing, or can build public and private partnerships of various kinds to have the private sector actually develop social housing. Similar models can happen for equity to really be actually achieved, both in terms of quality of services as well as long-term sustainability.
Thank you. How are we doing for time?
We're good. 20 minutes.
Good. So because there are a lot of interest for questions online. But I'm already seeing what is amazing is this conversation has been so enriching because I'm seeing a convergence of approaches, interests, and ideas, and an identification of potential gaps, where I think working together, a lot more can be achieved to support the Smart Cities program. But also this equity lens becomes, equity of access is a very good way of putting it, as opposed to saying, are we just trying to deal with the income differential, which are two very different things. So that actually, there's a question online that actually came up, which said that in order to increase equity, improve equity, I think community engagement in all aspects of the work becomes really important. So if you could share, what are some of the more successful ways in which the communities have actually been engaged? And how can the communities be actually engaged in kind of addressing some of these inequity questions and problems? So one of the things we ran into when USAID the India office has been at the forefront of a lot of innovation. And we were trying to do this innovation in urban health. Can we bring 5 million people in urban settings who are near poor into integrated primary care networks? And one of the things we ran into was that if you go to urban slums, the standard norms of what a primary healthcare center should look like will never suffice there, right? You don't have that luxury of building big things. So some of the governance issues, but the community wanted those changes to happen. So how do you see community engagement, both from a USAID perspective, but from a Government of India perspective, being the driver for addressing both the evolution of smart cities, but also addressing inequities in the system?
Well, I'll take the first shot.
Yeah.
I think what tends to happen in what used to happen, and now that's something which has changed, is that we always talked about the urban sector as urban health, urban transport, urban water, and so on and so forth. And then we almost as an afterthought used to bring the community back. It's almost like a vendor-driven approach where you say, well, I have a solution. So a vendor comes in and says, well, the problem I think you have is not having a solution to that, which is what we're trying to achieve now. And what that brings in is local innovation. What that brings in is fit for need solutions. And so we tried out, for example, just give one example. Tried out something called a living lab on mobility in Pune, the city I worked in. So we got a whole set of different stakeholders to come in multiple times and diagnose some issues. We picked up a certain area, and then we got research institutions and very well established, as well as startup companies to come and look at those problems. And we had multiple sessions with people, academic institutions, government officials, and online forum on which people shared ideas. And these private companies then came back with what came out with an exhibition of possible solutions. Until that exhibition, actually a physical exhibition, was their stuff was shown on computer as well as physically demonstrated orders, and citizens can come in and people can walk in this large scale engagement on that. And 3 of those solutions got picked up as pilots. So it forced another challenge to get them to scale up again. But there was a mechanism which was set in where co-creation did happen, and that's possible in many other areas. What the citizen and community doesn't want is that you go and that you don't come back. That's one way communication is done. It has to be a communication where you're actively involved, and it's progressive participation, where it starts from engagement to actually creating solutions and actually monitoring outcomes. Which is where, for example, in some of our funding for the government of India also, we are moving into a certain proportion of citizen feedback as part of our the monitoring of the programs. And so that's, in fact, the ease of living index I just talked about. That's another example. The third example, where 30% of what the city score comes actually from what the citizens in those cities talk about. So there's a structured way of engaging through a lot of online and offline platforms where people actually go to observe citizens and talk to them about different things that they feel about, and those then get incorporated into how the cities are then. So many different mechanisms being worked on.
I'm just going to build up what Kunal has mentioned, because I think it's exactly the way that all of us are thinking, whether it's USAID, whether it's GSI, and it's the notion of how do you do that co-creation? How do we recognize as supporters and donors that at the end of the day, the community, the ownership lies with the community. And so how do you make it viable that you have spaces where there's engagement, where there's thinking, where there's empowerment, that this is a long-term process? And that starts from the initiation of an idea. Forget, where we are in the second and third phases, but the initiation of where is this idea? What do we want for the future of this community? And who are the stakeholders here in the communities that can take this forward? How do we empower them to be able to do that? And I think that especially in communities where people have not been given that space, they have not been given that opportunity, this is a process. So one, we shouldn't anticipate that this happens rapidly, that we should create a process for this to happen so that you get the voice of, of maternal and child health needs. So you get the pregnant women, you get the older citizens, you get, parents with school-age children. So you get all of the different components that are required in demanding the needs and understanding what is necessary for them to exist beyond the basics. Because I think initially in any kind of city with people in the most vulnerable and marginalized sections, you're going to just work on the basics. And the smart cities are beyond the basics. So how do we make sure that the basics are met so that we can get to that next phase of what's required to actually thrive and contribute to that city? So that's what I wanted to add, but I wanted to invite Amanda, Cynthia to be able to build.
Well, just to build on that a little bit, just in the community, I think sometimes it depends on how long people have actually been living there, and especially some of the most vulnerable. They may be recent migrants and they don't really feel like they're part of the community. So it's a little bit harder, I think, to reach out to them. And I do think that having some sort of comprehensive primary health care or primary health care center available to them so that they can go in and talk about their needs is going to be important in the future. And the other thing is when you bring in people to talk about community issues, you have to be ready to address many of the different social determinants, things that come up. So if you're having a meeting about health, you better be ready to talk about water because that would be what is on everybody's mind. So I think just multiple things that come up in these community outreach sessions are important to address.
These are all great points. The only thing I'll add is we can add a link on the chat for those of you watching. We've done dynamic systems mapping to understand sort of where are the frozen points in each urban system in our 4 cities. And one of the big ones is where people have provided information and not gotten the right feedback or any feedback at all. It really shuts them down. So that's something that really has to be addressed in order to get that feedback going again. And we are actually working with Smart Cities Indoor to get the nurturing neighborhoods going. And that's going to be done in conjunction with the outcomes of our participatory research in several neighborhoods. So we did collect the data with the community. We're doing day walks with them so they can say, actually, this is what I think about this, and this is what I think about this, and we track these things as we go forward in this pilot to make sure. So it's a start toward all of the key points that the other panelists mentioned.
So I'm going to ask one final question. There are lots of questions from the audience. In the interest of time, I'm going to ask one final question and then I'll let you all have your concluding thoughts. Technology is at the basis and core to the Smart City initiative. So the question that came up from one of the members of the audience was that how can one use technology to better support intersectoral convergence? I think you touched on this, Kunal, a little bit, but if you can elaborate on it a little bit more, that would be really helpful. Because technology seems to be at the core of a lot of what is driving innovation, integration, etc.
So a lot of this actually depends on the context we're talking about. We have different governance structures across the world. Of course, within a country like India, it's a continent in itself. It's got different government structures and different ways of working in different states. So what needs to be done is to understand the best ways of using technology in that particular context. General principles of taking services online, that makes what we crudely call one window systems, where you don't know who's in the back end, but for you it's one window as a citizen. You go there, you're applying for a license which has 27 different permissions. It's not your headache to get them. You actually go to a place and the entire backend manages itself through the software technology provided for. That's one level of convergence that can be done. For that matter, it actually becomes a city as a service, where a lot of different functions you can go online from wherever you are in the world at whatever time you are, and you can access those services. And those are areas of work which are technology is easier part, but to get the backend to really integrate, it's really difficult because again the problem is of incentives. I honestly, if you ask me, I would not say decry a person who actually feels better working in a silo because they somehow find and it is somehow efficient in some ways. But to get this integrated working going, I think it's important to twist the incentives to be able to make that. It's not going to happen just because technology is going to make it possible. The incentives will have to get twisted for that to happen. So incentives have to be more outcome oriented. So you are as an organization trying to fix, you're not here to fix, you make footpaths. You are here to increase, healthy streets. So from this aspiration to build footpaths to an aspiration of building healthy streets, that can bring about integration with the backend. If you as a footpath developer, whoever you are, engineer, then link it to a broader set of outcomes that all others achieve. So those are mechanisms that need to be worked on. Of course, capacity building and integrated view is something that easily becomes possible. For example, the example that Amanda gave us, you could see prospectively which part of the city has more complaints, what are the different kinds of complaints. So, but that is a dashboard which is open to public and open to different companies. likely they may start to share resources, and, both human and financial, figure out whether there are some commonalities and some areas that could jointly be worked upon to solve those problems for them. So technology can give you a better access to what is happening in the city, both from the visualization side of it, analytics, and the integrated function. And as I said, in the Indian context, multiple different functions in the city are performed in multiple different organizations. In the licensing for transport will be done by a different organization. The tariff fixation is done by a different entity. The transport itself is provided by a different entity. The city builds the roads, and sometimes state organization also builds some of the roads in the city. In New Delhi, it's very difficult to find out which guy is responsible for what work. And these are systems which historically developed, so it's very difficult to. So in that sense, also technology becomes a very good integrator of sorts, where the required information, the required kind of coordination that is required between these organizations to work together. For example, solving the problem of pollution or air pollution, for example, it requires many different departments to work together. So that is something which is possible on a common platform where everyone sees the dashboard and see the common outcome, see the common goals. You know what your role is, how it's affecting others' role, and how the others' work is affecting you. And that's starting to happen in some cities. I can actually, so the dashboards that mayors have, and dashboards that have been developed, open to people, have actually started to coalesce and bring together the discordant agencies to work together on common goal. All of these things are starting to happen: capacity building, knowledge management, learning platforms, coordination mechanism, data analysis that I talked about, public-private partnerships, community feedback mechanisms. So these are where I think.
But do you want to add anything? Because though you integrated the SDGs explicitly into your work, I was wondering whether you were using technologies to kind of drive some of those integrations and decision making.
Yeah, well, indoor, the capacity there is strong enough that we didn't do a lot of the capacity side or the technical integration of information systems. That Makassar in Indonesia, that's been fully 60% of our work. It is a huge undertaking. But in indoor, we really focus on support to the citizen reporting system, that, and then we are going to be doing a training if students, COVID allows, to talk more about the integration indicators, because we did consult with the sectors on how to integrate those indicators, which we always say that's the first step. You have to get them all on the same page. But then it looks so daunting when you see 700 indicators. It really, it scares a lot of people off. So we're trying to balance those two functions. The one point I do want to make, though, from the health side, health has not helped itself with its information systems. They are so disparate, different platforms, different ways of hierarchy. So in addition to the data privacy concerns that we will have in terms of integrating health data into these dashboards, we have to overcome the technical side of that. And that has been a lot of what we've been doing with Makassar. It's getting there and it's going to happen. And I think that once it does, it will make multi-sector collaboration so much easier. But I don't want to fool anyone into thinking that it's going to be a quick fix.
So before, you want to add anything on
No,
this?
I mean, my only point to what both of them said is that technology is this equalizer, this potential equalizer, especially given the idea that we've got more cell phones, right? And so the fact that we're able to use it for the examples that they've demonstrated, both in terms of capacity building, we're seeing this in COVID, that we're able to train human health resources through online platforms from across the world. That's an idea that we haven't utilized before. Why? I mean, it takes a situation like this to prove that, but the potential that once you create incentives and have people bought into those incentives, you can truly use technology as an equalizer, for me, shows a way forward that can demonstrably change aspects of both integration, aspects of people's ability to engage in a way that's much easier than it's been before.
So before I turn to you for your final thoughts, what is amazing is that when you look at the research that has been done, there's a clear link between health and macroeconomic growth. There's a big literature on that, right? There is an emerging literature on urbanization and GDP growth rate, macroeconomic growth. But I think what we have not done is connecting the dots to say, can we move from health to well-being and then look at well-being, urbanization, and economic growth as three ends of a triangle or three legs of a stool. And I think what the Smart Cities program is trying to do is conceptually and practically try to bring these three aspects together. So what this discussion has really brought out is how do you move from health to well-being, but explicitly connect well-being, urbanization, economic growth as the engines of the future. And my only, to your point and the point everyone has made, this is a long journey. So the commitments on everyone's side has not to be for 5 years or 10 years, but this is a journey that is not going to end very soon. Right? So it's a long walk. And many times we're going to fall, we're going to get up, we're going to learn, we're going to go forward. So I hope this partnership continues. So I will start with, who would like to go first? Amanda, you want to go first, and then Cynthia, and then Anjali, and then Kunal, as concluding thoughts.
Oh, all right. Where's to go here? Well, only that I fully agree with you, and this is something we've seen again and again. I worked on Spring Project, which is the flagship nutrition project for USAID before coming to this, on multi-sector partnerships and financing and governance. And one of the big things we concluded is a 5-year plan isn't long enough, right? You've got to be able to think about that 10, 15-year path, right? But I think India is in very good stead in that case because they have that conversation. Right? But I do think as each country thinks about how they formulate their smart cities programs, I hope that they're thinking about that horizon and also getting the well-being and health indicators and goals into the heart of those initiatives. I'll stop with that.
Just to follow up on what you said on health to well-being, I think that now really is the time. I mean, it's been a terrible time all over the world with COVID, and we dealt with this, still dealing with this in the US. It was bad for the second wave in India, and health is at the front of everyone's mind, and we really need to sort of capitalize on that and really pay attention to it now as we work on urbanization issues and working with smart cities. And I feel like we sort of all aligned here, and I look forward to working with all of you in the near term on some of these important issues. So thank you.
Thanks. I'll just build on the point in terms of the long journey. I think that it's really easy to overlook the fact that these ideas, these notions, these processes take so long. And so when you're trying to make that triangle, the lack of success in that space can happen when you look at it from that time period. I think the evaluations that we've done, highlight this, but specifically thinking that operationally to take this forward, you need so many underpinnings in the government and the city to function properly, and that's a process in itself. Whether it's cash disbursement, whether it's the function from the state to the district level. So I just want to emphasize that in order to get that triangle to work, there is a whole back room that needs to function, and how much can we invest in that to make sure that these overlays that we're talking about can be successful.
Yeah, and final thoughts.
Yeah, I think, for me, what emerges is two pathways. One is a larger long-term strategic pathway. The second one has to be a more tactical on the now focused pathway. Because clearly the strategic long-term ones sometimes frustrate. You have too much of hunger for results now. So you need this tactical. So the strategic one has to be focused on what you guys are talking about. And instead of health or streets or waste or water, well-being. So the systems approach is something that we try to engage on and see if we can talk together in such a way and develop as a practice in the city. And the second one is this tactical approach, which I basically defined by test, learn, and scale. So test out new ideas, look at what comes out, the outcomes to scale it up. May not be scaled up in a linear fashion, but some kind of modular scaling where, let's say, X and Y and Z, three ideas to test out in different cities. Maybe X plus Y works in some other place, and X plus Z works in some other place. Or maybe X plus Y plus Z works in some other place. So it's not linear, it's modular. It's very important because again the context and the community is so important. So these are ways in which I think we need to build deeper practice. And we will never have a better figure than that. Because we can't really get these two aspects right now. This last opportunity. So I would actually invite like-minded people to engage with us, and especially specialists, people who are really desirous of making change in the sector of health, especially in countries like India. We would be happy to work together.
Thank you. I want a big round of applause and thanks to all the panelists for as well for staying on and listening to this. Thank you.